South Africa, which recorded some of the earliest cases of Omicron, is seeing a major increase in cases. Over the last week, the daily number of new COVID infections has increased fourfold, from less than 3,000 to more than 11,500, 3/4 of which are Omicron. So far, hospital admissions remain low and symptoms of the new variant are reported to be mild. But early figures suggest an increase in the number of people who've had the virus becoming reinfected. Our Africa correspondent Andrew Harding has more.
It's summertime here in South Africa, but a shadow looms over the beaches and holiday season. A fourth wave of COVID infections is spreading fast, driven by the new variant.
Are you worried about this new variant, Omicron?
The new one? Yeah, I'm worried.
We don't know what the new variant's like. So
what the symptoms are,
exactly.
how
we don't
bad the
know
symptoms
how
are.
it would affect us now, and it makes you really scared.
At their laboratory here in Durban, the scientists who first identified the Omicron variant are racing to unlock its secrets. And now the first hints are emerging of what the mutations on the virus mean.
I think the epidemiological evidence is that we think it's you're more likely to get reinfected if you had COVID before. So that is because of the mutations on the spike protein. We don't know much about transmissibility, but I think looking at the mutational formation, we think it may be more transmissible than even Delta. In terms of clinical problems, we have no evidence that this is a more severe virus than, let's say, Delta, Alpha, or even Beta.
That bears repeating. Although hospital admissions are rising sharply here, it won't be at all clear, at least for another week or two, whether the Omicron variant is more severe, more dangerous. In the meantime, above all in rural South Africa, another problem lurks: vaccine hesitancy. This builder tells a visiting health worker that he won't get a jab, even with the new wave of infections.
Do you find it frustrating, all these people saying no?
It is. It's very frustrating because we believe that if all of us have already vaccinated, we will be safe.
As this virus spreads fast now across South Africa, the real problem here is not a lack of vaccines, it's the fact that younger people seem very reluctant to get a jab, which is where these activists come in.
He's willing to go
Trying to persuade the public in a country where so far only a third of adults are fully vaccinated.
The guy said they would like to go and take their vaccination after we had a talk.
Success.
That's a success, and we thank them by clapping hands.
One small victory, but South Africa has a fight on its hands. Andrew Harding, BBC News, Durban.